we actually have one more speaker who is not listed in your program. I want to introduce Jennie Storms. She's from New Jersey. She's a pediatric registered nurse, an advocate for medical cannabis, and the mother of a child who is using medical cannabis. Jennie.
Thank you for having me. I first want to thank all of you who have done this for the last umpteen decades to get to where we are today. I apologize for being so ignorant about medical marijuana in my own state as well as the United States. I can tell you I voted in 1996 for California when I lived there to become a legal state, and I've moved to New Jersey. I know why. So let me tell you about New Jersey. You all know that we have the wonderful Governor Christie, and he wants to be our president. So let me tell you about how he has single-handedly tried to wreck New Jersey's program, as I've experienced it. I do have a 14-year-old child who is a cardholder who needs medicine and cannot access it in the state of New Jersey. So when I found out medical marijuana can help my son, I looked into it, and this is what I discovered. In 2010, the legislature actually passed with the signature of Governor Corzine, apparently at 3 a.m. in the morning, as Governor Christie has informed me just the other day. Governor Corzine signed the bill and let Governor Christie inherit it. He was not happy, and what happens when Governor Christie is not happy? Let's say that he has single-handedly tried to destroy this like he blocked the bridge. He inherited the program, he has regulated it to death, he wants a strict medical program. The problem is he is creating a program that is not going to work, and it never will work the way it currently exists. He originally wanted it to go through hospitals. Hospital-based programs aren't going to work for the reasons that we just heard. It's very complicated, and it offers no compassion for those who are most in need. He put in place in 2012 some regulations. So keep in mind the program passed in 2010. He finally got regs out in 2012. He did not ask for information or how to implement this program with patient input. Advocacy groups, including the Coalition for Medical Marijuana New Jersey or the Drug Policy Alliance. I do not believe we have an ASA chapter, nor has anybody asked for help from them either. Some of the stupid regulations we have are that you must have a 2-ounce limit per month. That's it, 2 ounce. He originally put in a 3-strain limitation. Dispensaries could not grow more than 3 strains at one time. Your THC limit could not exceed 10%. There's a mandatory physician registry, which is scaring away legitimate doctors who really know that this works as medicine, but do not want to be ostracized or somehow put on that list of people who should not be prescribing marijuana because it's an evil thing. We all know different. It also required fingerprint, background checks of caregivers and patients. And you know the only thing they're checking for is drug convictions. So you could be a murderer and get your medical marijuana card in the state of New Jersey, but you cannot have drug offenses without proving rehabilitation. We also have a sales tax. The state has supposedly set the price per ounce of $500 per ounce in an attempt to divert it from the streets. Is what Governor Christie is doing. He's actually creating an underground market that is much more profitable and much more affordable for those who are in need, who are qualified patients. We have six dispensaries that are approved. They all must be nonprofits without nonprofit status or benefits. 2 are allowed in each region of the state, 2 in northern, 2 in central, 2 in southern. No home growing is allowed. The only forms you're allowed in the state of New Jersey is to smoke bud, eat lozenges, or to apply lotion to yourself. That's it. All testing is done by the Department of Health. There are very limited restrictions on what qualifies. 6, to be honest with you. If you have Lou Gehrig's disease, multiple sclerosis, terminal cancer, muscular dystrophy, IBS, Crohn's disease, or terminal illness, and the doctor says you have less than 12 months to live, you may start the process of a 3 to 12 month process to get your card at a cost of around $1,000 to get your card, including the background check. And if you need a caregiver, they need a background check and they have to pay that $400 for the card, or $200 for the card as well. If the patient is resistant to conventional therapy, we give you another 3 disorders. Seizures or epilepsy, which is where my child falls in, he has Dravet syndrome. Intractable skeletal muscular spasticity, and glaucoma. Additionally, if you have severe or chronic pain, nauseousness or vomiting, cachexia, wasting syndrome, and you have AIDS, you're positive for HIV, or you have cancer, then you may also apply. Very costly, very expensive. You have to go through a 1-year process in establishing a relationship with a new doctor because none of the doctors who are currently treating you want to go on the registry. No changes are allowed until after the 2nd annual report has been issued and progress is assessed with the program in New Jersey. So in 2010, we passed a law, regs were created, and we waited. 2012, December, we opened our first dispensary in northern New Jersey, Montclair. It's called Greenleaf. Currently, today, it's open 1 day a month. Welcome to New Jersey. In October of 2013, we actually opened up a dispensary down in southern Jersey. That one is the Compassionate Care Foundation in Egg Harbor. They actually offer a discount to every client who comes in, so their medication is only $400 per ounce, and they're the cheapest in the state. December of 2013, in Central Jersey, we opened up the Garden State Dispensary in Woodbridge, and they actually have a model in Colorado, and they, to date, haven't been the most successful, but we do have, between Egg Harbor and Woodbridge, 2 functioning, operational, open 7 days a week dispensaries. In 2013, there was a conditional veto of a bill called S-2842. I was involved in that for my son. As I told you earlier, smoking was the only way I could give my son medication. My son can't smoke, he can barely talk, and he's on a ton of medications. He also uses oxygen. So we petitioned the governor to go ahead and let our children have the edibles. And actually, we petitioned for the patients, not the children. And he offered a conditional veto. And there was some accomplishments with that. He eliminated the 3-strain limitation, so no longer were dispensaries limited to 3 strains. Could you guys imagine having to choose between 3 brands? So that has been eliminated, but he limited edibles to minors only. So that's really important to realize that only minors. So once my son and other children turn 18, you have to now start smoking marijuana. It makes no sense, but that's what Governor Christie thinks. He did retain the 3 unrelated doctors for minors, so in order for my son or any minor in the state of New Jersey to get medical marijuana, not only do they have to see a medical marijuana prescribing doctor for the registry, they also have to see a psychiatrist and a pediatrician. So I need 3 doctor recommendations. Talk about hiking up the price of that card. January 2014, Governor Christie vetoed S-1220, which actually eliminated the opportunity for establishing as medicine marijuana in the state of New Jersey. It also would allow organ donors, I believe we had this come up in California, where it would allow the organ donors to be able to become recipients. He vetoed it. He also vetoed the hemp bill. What we need in New Jersey is we need protection from arrest and access. We need safe hospital-based care. We need to have the physician registry eliminated. We need to have honest regulations that actually are going to work. I can tell you my son has been kicked out of a hospital as a card holder for his medicinal marijuana use. I have a friend who was stabbed by his roommate, and while they were investigating the crime of him being stabbed, he was arrested as a card holder for marijuana possession, and the charges are still pending. In New Jersey, our law is called KUMA. Currently, the Attorney General in New Jersey has only distributed those guidelines to the state troopers, not to the municipalities and the townships. Again, our program's costly, it's confusing, and it is just not working. In 2011 and 2012, multiple patients did sue the state and the Department of Health for lack of access. I can tell you that to date, there is only 1 surviving complainant. And that's really sad. The New Jersey courts denied to hear it. They sent it to appeals. That's where it's at now. And actually, in the state of New Jersey, the appeals court actually said it found New Jersey in failure of compliance with their own rules and regulations. It said that annually and biannually, they must issue a report on the status of it, because that's the point where we can add new conditions. That's the point where we can actually start helping other people and adding what is needed and actually having a true medicinal program. So those actually came out in February, and since they're 3 years late, they're still refusing to add anything and accelerate the process of helping our soldiers with PTSD or other people who have qualifying conditions that really should have access to medicinal marijuana in our state. We do have currently legislation. The 2 bills I mentioned that were vetoed in January are up again. We do have a right to farm bill as well, which would allow home grow. As a single mother, I don't have $500 an ounce. That's $1,000 a month that I would have to spend to get his medication to save my son's life. And because medical marijuana program in New Jersey is not working, Senator Scutari just recently has actually presented legislation based on California and Washington, because no one wants to be like California, or excuse me, Colorado or Washington, highlighting the benefits of taxation. He actually feels that that's something that would work. And as a parent of a child who needs medical marijuana, I have a feeling it would work, because then all of a sudden, no one's going to be looking at legalization and going, oh my gosh, what about that medical program? Because the medical program, like Colorado, is going to be forgotten. So yes, I am for legalization, because you know what? Having that glass of wine repeatedly every single night for 10 times in that one night is much more dangerous than that single joint someone may want to smoke. And lastly, Senator Gusiora has put a voter referendum, and he's doing it through the legislature. New Jersey, like the legislators, everybody has to go through them. It is actually Assembly Bill 2842. Ironically, the same exact number as the bill from last summer that was conditionally vetoed. And basically, if both houses of the legislature and the governor sign this, it will go to the voters of the state of New Jersey and let them decide. And it will allow for possession of less than 1 ounce of marijuana as a legal remedy in the state of New Jersey. So let's let the voters of New Jersey decide. Okay, thank you.